Hello there. We're thrilled to have you here at Active Life Picks. Don't forget to hit the subscribe button for more exciting content. Our aim here at Active Life Picks is to keep you informed and engaged, offering insights and advice on a wide array of topics. Today, we're going to delve into a subject that affects many families across the globe: separation anxiety disorder. This condition can be challenging, but with understanding and the right tools, it can be managed. Now, let's dive into today's topic: separation anxiety disorder. Separation anxiety disorder, or SAD, is a condition where a child experiences extreme fear and nervousness when away from their loved ones. This fear is not your typical childhood worry about the first day of school or a sleepover at a friend's house. It's an intense, unrealistic fear that something bad will happen to the caregiver or themselves if they are separated. Children with SAD may refuse to go to school, insisting on staying with the caregiver. This is more than just playing hooky. It's a deep-seated fear that can lead to tantrums or pleading. Similarly, bedtime can become a battleground, with the child refusing to sleep unless the caregiver is nearby. Sleepovers or trips away from home, they're out of the question. SAD is not just a mental and emotional challenge, it can manifest physically as well. Children may complain of headaches or stomachaches at the thought of being separated. They may even resort to bedwetting. These physical symptoms are not a ruse or a play for attention. They are real, tangible manifestations of their anxiety. Then there's the fear of being alone, which can be crippling for a child with SAD. It's not just a dislike for solitude, it's a paralyzing fear that can lead to nightmares about separation. Along with this fear comes guilt. Children with SAD often feel an intense sense of guilt about their feelings and their inability to be apart from their caregiver. They may feel that they are doing something wrong or that they are causing problems. This guilt can intensify their anxiety and make the situation even more challenging. In a nutshell, separation anxiety disorder is a complex condition that can affect every aspect of a child's life, from their physical health to their emotional well-being. It's a storm of unrealistic fears, refusal to be separated, physical symptoms, and intense feelings of fear and guilt. These symptoms can be quite distressing for both the child and the caregiver. But understanding them is the first step towards managing them and helping the child lead a healthier, happier life. Scene script. Several factors can contribute to the onset of separation anxiety disorder. To start, a significant stressful or traumatic event in a child's life can trigger the development of this condition. This could be anything from a major change, such as moving to a new house or school, to a traumatic event like a serious illness or the loss of a loved one. Next, overprotective parents can inadvertently foster separation anxiety in their children. When children are excessively shielded from the world, they may struggle to develop the necessary coping mechanisms for handling separation and independence. This isn't to say that parents should abandon their protective instincts, but rather, they should strive to strike a balance that allows their children to grow and learn in a safe, supportive environment. Family history also plays a role. If there's a family history of anxiety or other mental disorders, a child may be more prone to developing separation anxiety disorder. This is due to a combination of genetic factors and learned behaviors. Insecure attachment to parents or caregivers is another potential cause. Children who haven't developed a secure attachment may fear abandonment, which can trigger separation anxiety. This attachment style can stem from inconsistent or unpredictable responses to a child's needs. Stress, in general, can also contribute to the onset of separation anxiety disorder. This could be stress related to school, peer relationships, or even family dynamics. It's important to remember that what seems insignificant to an adult can be hugely impactful to a child. Finally, the presence of other anxiety disorders can increase the risk of developing separation anxiety disorder. These could include generalized anxiety disorder, panic disorder, or social anxiety disorder, among others. In essence, the causes and risk factors of separation anxiety disorder are multifaceted and interconnected. There's no single cause, but rather a combination of factors that can contribute to a child developing this condition. Understanding these factors can help in early detection and intervention. It can also lead to more effective, personalized treatment strategies that address the root causes of a child's anxiety, rather than just the symptoms. By understanding the causes, we can work towards a future where every child feels safe, secure, and confident in their ability to handle separation. If you suspect your child might be suffering from separation anxiety disorder, it's essential to seek professional help. Let's talk about the process of diagnosing separation anxiety disorder, or SAD. You see, the first step is for a doctor to check your child for signs and symptoms of SAD. This might involve observing your child's reactions in various situations, asking questions about their behavior, and looking for patterns that might indicate anxiety. If signs of SAD are present, the doctor will then delve into your child's medical history, and a physical exam may be conducted. This is done to rule out any physical ailments that might be causing or contributing to your child's anxiety. But the diagnosis doesn't stop there. The doctor might refer your child to a child and adolescent psychiatrist or psychologist for further evaluation. These specialists are equipped to understand the complexities of a child's mind and can provide a more in-depth analysis of your child's condition. Now, let's move on to the treatments available for SAD. Cognitive behavioral therapy, or CBT, is the main form of treatment. CBT helps children change negative thought patterns that lead to anxiety and fear. It's a process that encourages children to face their fears and learn that bad things don't always happen when they're separated from their caregiver. Family therapy may also be recommended. This form of therapy involves the entire family and helps everyone understand the child's anxiety. It's a team effort to create a supportive and understanding environment for the child to thrive. In severe cases, medication may be used as part of the treatment plan. However, this is usually considered a last resort and is employed only when other forms of therapy have not been effective. The journey of managing SAD may be challenging, but remember, it's a process. It's about taking small steps towards a healthy mind, and it's crucial to be patient and supportive during this time. Early and appropriate treatment can significantly improve the child's quality of life, because every child deserves to live a life free from the shackles of overwhelming fear and anxiety. While there's no known way to prevent separation anxiety disorder, recognizing the symptoms early on can ease distress and prevent further complications. It's important to understand that the earlier these symptoms are identified, the better chance we have of successfully managing the condition. A child's fear and anxiety are real, and it's our job as caregivers to provide them the comfort and support they need. One of the key ways to support a child with SAD is through family involvement. It's crucial that everyone in the child's life, parents, siblings, extended family members, even teachers, understand what the child is going through. This enables them to provide a consistent, nurturing environment that helps the child feel safe and secure. Remember, it's not about fixing the child, but about helping them manage their fears and anxiety. Family therapy can also be an invaluable tool in this process. It can help the family understand the child's condition and how to support them effectively. It can also provide strategies to reduce the child's anxiety and improve their coping skills. In severe cases, medication may be used, but this is always considered as a last resort and used under the supervision of a medical professional. Now, let's talk about the outlook for children with SAD. It's natural to worry about the future when your child is going through something like this. But take heart. Most children with separation anxiety disorder improve over time, especially with the right support and treatment. Yes, their symptoms may reappear during stressful times, but with the coping strategies they've learned, they're better equipped to handle these situations. In many cases, children with SAD grow up to lead normal, healthy lives. They go to school, make friends, pursue hobbies, and eventually become independent adults. It's a journey, and like all journeys, it has its ups and downs. But With patience, understanding, and the right support, it's a journey that can be successfully navigated. With the right support and treatment, most children with separation anxiety disorder can lead normal, healthy lives. It's a message of hope and reassurance that we all need to remember. Separation anxiety disorder can be a challenging condition, but with understanding and the right approach, it can be managed effectively. We've covered a lot today. We've learned that separation anxiety disorder, or SAD, is a condition where a child experiences intense fear and worry when separated from their caregiver. The symptoms can range from unrealistic worries about harm befalling the child or caregiver, refusal to go to school or sleep without the caregiver nearby, to physical symptoms like headaches and stomachaches. It's important to remember that these symptoms are real and can be quite distressing for the child. We've also discussed that causes can include stressful events, overprotective parenting, family history of mental disorders, and insecure attachment. It's not about blaming anyone, but understanding the factors that can contribute to this condition. Diagnosing SAD involves checking for signs and symptoms, understanding the child's medical history, and possibly referring the child to a specialist for further evaluation. Treatment typically includes cognitive behavioral therapy and sometimes family therapy. In severe cases, medication may also be used. While there's no known way to prevent SAD, recognizing and acting on symptoms when they appear can ease distress and prevent issues associated with school avoidance. The outlook for children with SAD is generally positive, especially when treatment involves the entire family and starts early. Thank you for joining us today at Active Life Picks. Remember to subscribe for more insightful videos. Until next time, take care.